Welcome back. I bet a lot of you who are watching this program right now have experienced back pain at some time in your life. Well, according to the experts, 80% of all Americans will experience back pain at some time in their life. So what causes this? Are we all lazy? That could be part of it. Dr. James Osborn, who's an ortho spine surgeon with Spine Surgery Associates here in Chattanooga, is here to talk to us about lower back pain or just back pain in general. And this primarily occurs, I think I understand, in baby boomers?
No, actually back pain is common across for everyone.
Everybody. Doesn't matter if you're 20 or 60.
Correct. It's more common as you get older and occurs more frequently as you get older.
Now, is that because as you get older you have a tendency to do less as far as exercise?
To some degree.
Yeah.
I mean, your body changes. You start growing hair you never did, and you lose hair where you used to have it.
Wait a minute now.
So everything changes as you get older, and part of that aging process is you are more susceptible to injury, and so it's an issue of your knees wear, your back wears, and it's a matter of how to take care of that.
What are some tips?
Well, the tips are to come to the lecture for one.
There you go. We got a lecture. We'll tell you where it is in just a minute and all that.
The next thing is paying attention to how you lift things and what to do. And the biggest thing is how to prevent these from recurring, and that is aerobic conditioning and toning and basically some preventative care that is relatively non-invasive on your side, but helps out quite a bit in the long run. Yeah,
it's just simply because you do some more movement of the body, it'll get a little used to movement.
Well, yes, and there's some degree of if you don't use it, you lose it. Things you can overdo and wear things out, and you can also underdo and things degenerate as a result of that. But part of the aging process is things wear out and it causes discomfort, and then how do we manage those pains effectively without avoiding surgery?
All right, is treatment a lot of times for something that you've twisted or whatever else? Is it just rest and heat and medication perhaps, or? And I know that's a kind of a general paintbrush thing. But
and those are good generalities. At one time, it used to be that you would rest and people would be hospitalized for back pain for days. That's
really?
many years ago.
Okay.
Now it's more to get you active in the appropriate activities. Okay. With a little bit of rest, a little bit of medication, and the appropriate strengthening program or physical therapy program to help you get past that pain.
All right, if a person is experiencing pain, how long should they wait before they consult with a physician? You know, you wait a week or just a couple of days?
It depends on the intensity of the pain. Pain can be divided into mechanical back pain, which is things that hurt with activity. I went out and raked the yard today and I had back pain. So that I expect to go away.
Yeah.
Then there's neurogenic pain, where all of a sudden my legs stopped working. That is obviously a more severe issue, and you'd want to see your doctor sooner. So it's a matter of how severe it is and what kind of pain are you having. But certainly, you know, if your leg's not working, you better go.
Oh gosh, yeah. So again, it just depends, and of course, it's always best sometimes to err on the side of you know, whatever they say it is, than it is doing without getting in real pain.
Always. I mean, it's a situation where it's always good to call.
All right, let's talk about this Get Back lecture that you're going to be doing, because it's on October 27th, coming up in a couple of weeks.
Correct.
6 to 7 o'clock at Erlanger North Campus Annex, and people must register. That's the big thing we want you to know. There's no charge for it, but you need to register by calling 778-LINK, which is 778-5465, and you're going to touch on stuff that you didn't have near the time to touch on today with 4 minutes.
Right. I mean, basically, we're going to talk about the basic causes of back pain, then the things you can do around the house to avoid injuring yourself, and then the long-term thing. How do you make the best of your life and keep your back in the best shape so that you can avoid visiting me as a surgeon?
Yeah. That's what we want to do. We don't want to come see you, do you?
No, you want to see me, just not have an operation if you don't need it.
Thank you, Doctor. We appreciate it very much. There's the information. You can go to our website, newschannel9.com, and you will find it. Right now, let's join Mr. Food. He's in the kitchen, and he's going to make, I am told, apple nut muffins.